So, as many of you know, I serve as the Vice Chair for the Standing Committee on Health and the Shadow Minister for Health for the Conservative Party of Canada. So obviously I've been tasked with looking at public policy as it relates to COVID. But there's a bit of a problem that I've had in doing this. I've been asking the federal government for some pretty basic information, like after 10 months, we should know things like who is the most vulnerable in Canada, who is most likely to get this and why, how is it transmitted and in what circumstances, what are the long-term impacts. These are questions that the government should be tracking and have some publicly available data on because of the cost of the measures that they've been recommending, as well as the need to measure whether or not they've been effective or not, right? Like if something's not preventing the spread of it, then maybe we shouldn't keep doing it and we should be doing something else. Now, this isn't just me saying this as a politician. Many leading epidemiologists, immunologists, and public health officials across the country have been saying this, but it's kind of been like a taboo topic. Like if you talk about, hey, where's the data on this? It's kind of like, oh, well, you know, why are you even questioning this? Well, I think 10 months in, we're at a point in time where we need to be questioning if public health policy decisions are being made on sound data. And today in the Toronto Sun, I just got this article. There's a really interesting article up that's called "The Important COVID Data from Alberta That All Canadians Need to Know." And it's some data that the government of Alberta has released on the level of essentially comorbidities or other health conditions that people who have very tragically passed away from COVID have had. Now, why is this important? It's important for us to know this because it allows us as public policy makers to determine whether or not the measures that we're putting in place are working or if we need to be looking at other things. And we also need to be looking at, after 10 months, some of the other health impacts that we've seen because of the measures that we put in place. Like we know that we're seeing a mental health crisis across the country. We're seeing high numbers of opioid deaths. We're seeing mental health issues related to job loss. I've had professional associations contact my office that are concerned about, access to other medical services. So I think that we need to be making data-driven decisions, and the federal government has a huge role to play. Justin Trudeau has a huge role to play in this. I mean, we've watched him and his health minister go out and flip-flop on decisions the entire time. And then they're coming out. I just had this interaction with the Prime Minister in question period, which was a non-answer, of course. But I think, the federal government they have a leadership responsibility. They've abdicated a lot of their responsibility to trying to pass it down to the provinces. They really haven't given the provinces the tools that they need, be it data or things like rapid testing or other therapeutics. Like they haven't really done this, and the provinces are kind of left to scramble, and I just don't think that's right. So I encourage you to have a read through this article because it's the first time in a long time, after 10 months, I've seen somebody publicly poke what has been a very taboo topic, which is who's most at risk, and are the health measures that we're undertaking best positioned to stop the spread and protect those that are most at risk, while recognizing that there are a lot of other impacts to the measures that we've undertaken: job loss, mental health, the effect of people not being able to visit family members, et cetera, et cetera. Like we need to have this data. So I need your help. I need the Canadian public to say a couple of things. First of all, we recognize that this is a very serious situation. There are people who have passed away from COVID, and we know that if it spreads in certain populations, that it can have a huge impact on the health and safety of our entire community, be it the impact on intensive care units, our healthcare workers, etc. But what I'm saying is we need to understand how it spreads. That data has to be publicly available so that we can target these measures so that they're the most effective possible, while ensuring that we recognize that we can't just continue extended lockdowns forever because people can't afford that. You know, it's dark and it's cold outside now here in Canada. It's not the summer where people can go for walks outside or spend time outside and potentially prevent the spread. We need better measures because I'm worried about compliance. You know, the federal government, I'm sure they'd watch this and go, oh, well, everybody's just going to be compliant. We want people to be compliant, but I mean, you need to work. Your kids need to go to school. We need to have some modicum of normalcy in our lives. So we should be figuring out how we do that based on the data on how it spreads with the best available options, which is why my colleague Erin O'Toole, the leader of the Conservative Party, and I have been advocating for things like rapid tests or at-home tests so that we can understand where this thing spreads. But again, just to reemphasize, as the vice chair of the health committee, I don't really have access to any data that I'm talking about here. And that's really not great 10 months into the pandemic. So encourage the federal government and Justin Trudeau to give us that data. That's not really a political position. It's just, we need data. We need to understand this. I want to see this information as a Canadian citizen because I want to know if the decisions that you're making as a public policy maker are in my best interest, if they're going to keep me healthy, if they're going to keep me safe, and if they're going to look at all of these other issues at the same time. They're the best options. So share this video, and if you can, write to your MPs, especially if you're in a Liberal riding, and say, can you encourage the Prime Minister and the Health Minister to take a leadership role and get this data and make it public, as the government of Alberta has done today? Working hard for you. Have a great day.